welcome to our session. Our topic today is Yes, I can detect cancer early. Yes, I can survive cancer. For this International Women's Day, we bring you some in-depth discussions from the best oncologists, geneticists, genetic counselors, pathologists on women cancers, women health, and its management. So today we have with us Gouri Pandit. She's a senior genetic counselor at Indus Health. Thank you, Gauri, for joining us. I'm so glad to catch up with you again and be fellow genetic counselors.
Hi, Payal. Thank you so much for having me. It's always a pleasure to talk to you, interact with you, share ideas with you. So I'm really glad to be here.
Same here. So, Gauri, as you know, our theme is Yes, I can detect cancers early. So my questions are somewhat around cancer awareness. And genomics, which has been your specialty. So let me ask a couple of questions. So what kind of people should consider genetic testing? Is it for everyone?
So, like we used to say that there are certain, specific flags that a person should consider or have in mind. Specifically when you want to understand your risk for cancer. So ideally, yes, whoever wants to understand his or her risk for cancer can think of going for genetic testing. However, anybody who has a member in the family who has been detected with cancer at a fairly early age, maybe I would say lower than 50 years of age, or someone who has more than one members in the family who have been diagnosed with cancer. This could be either side, maternal or paternal. Someone who has a person who has more than one cancer, in more than one organ. So these are certain red flags that a person should keep in mind. And if any of these factors are there, then they should definitely think of going for genetic testing. And of course, first evaluate the hereditary risk, first go for genetic counseling, and take it ahead from there.
Thank you. And my second question is genetic testing only for women? Because we hear a lot about BRCA1 and 2 and its linkage to women.
Absolutely. So there's this, myth in us that whatever conditions, diseases or conditions that could be passed on can only be passed on from the mother's side, because she is the childbearing person, or she bears the child. However, that's of course not true. Why? Because especially the cancers, now the genetic changes that happen in cancers are not on the sex chromosome. So we have two different types of chromosomes. One are the autosomes and the other are the set of sex chromosomes. So these genetic changes are present on the autosomes, which are not gender specific, which are passed on equally to both men and women. So yes, not only women are the ideal candidates for genetic testing. Even men should undergo, and even a person who has a family history of cancer on their paternal side should definitely, most certainly consider offering genetic testing. So especially like you mentioned with BRCA1 and 2, we do have men who are positive for a BRCA1 or a BRCA2 gene mutation, and we also do see male breast cancers, for that matter. And in this particular syndrome, we also not just breast, but there is also a risk of prostate cancer. So definitely men should also consider genetic testing for this.
Thank you. And lastly, Gauri, any message for us women on this International Women's Day?
Well, what I would like to say is don't feel guilty about wanting to take care of your health. Okay, you deserve it. Women are, they feel burdened, or they feel like, okay, they can keep their health or their well-being aside and then first look after the family. But I always say, jaan hai to jahan hai. So it is very important for us women to actually take care of our health, not feel guilty about it, not feel burdened about it. And especially us millennials or working women, we are now more aware about a lot of things. We are more aware of what we want, professionally, personally, everything. So I think if you feel like it, you should just go for it, honestly. And yes, health comes first, utmost, your physical health, your mental health. So I think, yeah, that would be my message, that just be guilt free and take care of yourselves properly.
Thank you so much, Gauri. Thanks for joining us.
Thank you, Payal.